Secretary of State, Matt Hancock.
Thank you very much, Mr Speaker. Mr Speaker, I'd like to update the House on the actions the Government's taking to protect the public following cases of listeria in hospitals linked to contaminated food. The NHS has identified 9 confirmed cases of listeria in 7 different hospitals between the 14th of April this year and the 28th of May, all linked to contaminated sandwiches from a single supplier. All of the known cases involved inpatients, and very sadly, 5 people have died. And, Mr Speaker, I'd like to express my condolences to the families of those who've lost a loved one, and I promise there will be a full and thorough investigation and severe consequences if there's any evidence of wrongdoing. Lab testing indicated a link between 2 cases in Manchester Royal Infirmary and 1 case in Liverpool. Contaminated sandwiches were identified as the likely cause by Public Health England. The manufacturer, the Good Food Chain, and its supplier, North Country Cooked Meats, have withdrawn the sandwiches and voluntarily ceased supply of all products on the 7th of June. They're both complying with the Food Standards Agency on a full product withdrawal. Mr Speaker, the other cases have been identified at the Royal Derby, Worthing, William Harvey in Ashford, Wexham, Leicester Royal Infirmary and St Richard's in Chichester. The risk to the public is very low, but any patients or members of the public with concerns should contact NHS 111 or, of course, 999 if they experience severe symptoms. Listeria infection in healthy people may cause mild illness but is rarely fatal. But for certain groups, it can be much more serious, as we have tragically seen. Mr Speaker, the NHS, Public Health England and the Food Standards Agency have acted swiftly to identify, contain and investigate the cause of this listeria outbreak. These deaths should never have happened. People rightly expect to be safe and looked after in hospitals, and we must ensure that we take the necessary steps to restore that trust which the public deserve to be able to hold. Mr Speaker, this isn't just about ensuring the food we serve in hospitals is safe. The NHS served 140 million main meals to inpatients last year, but ensuring that food given to patients is healthy, nutritious and aids their recovery is important. So I can inform the House that we are launching a root and branch review of all the food in our hospitals, both the food served and the food sold. The Government will work with the NHS to build on progress in 3 vital areas. First, eliminating junk food from hospitals. Since the introduction of the NHS Action on Sugar scheme, we've halved the sale of high-sugar soft drinks, and trusts are taking action to remove unhealthy food and drink and replace them with healthier alternatives. After all, hospitals are places for good health. Second, improving nutrition. New national standards for all healthcare food will be published this year. All patient menus will have to ensure minimum patient nutrition standards are met. And third, healthier choices. We'll work closely with the Hospital Caterers Association and others to ensure healthier food choices are available across the NHS. Mr Speaker, the review will identify where we need to do more, where we need to do better to improve the quality of food in our hospitals, and how we can help people to make healthier choices. I know this is an issue that many colleagues in the House feel strongly about, as do the public, and we will do everything we can to ensure that the food we eat in hospitals is both safe and healthy.